Most breast changes are due to hormonal changes and are nothing to worry about. However, if you experience any of the following 5 breast cancer symptoms, see your doctor even if they seem mild. 1. A lump in the breast or armpit. 2. Discharge from the nipple. 3. Dimpling on the breast. 4. Nipple changes, including the nipple turning inward, pulling to one side, or changing direction. Or 5. Irritation of the skin. A breast lump is the most common presenting symptom of breast cancer, but for about 1 in 6 women with breast cancer, the broad spectrum of symptoms doesn't include a lump. Breast cancer occurs when breast cells mutate and grow out of control. If breast cancer spreads, it typically goes to nearby lymph nodes under the arm first, or around the collarbone. If it spreads beyond these small glands to other parts of your body, it's called metastatic breast cancer. Metastatic cancer is incurable, so early diagnosis is very important. Your risk for breast cancer increases with age. About 77% of women are over the age of 50 when they are diagnosed with breast cancer. Less than 1% are diagnosed in their 20s. If you have a close relative, a mother, sister, or daughter, who has had breast cancer, your own risk of developing the disease doubles. If 2 of these relatives have the disease, your risk increases 5 times. In many cases where breast cancer seems to run in families, a mutation in specific genes, called BRCA1 and BRCA2, may contribute to the cancer. If you started menstruating before age 12 or went through menopause after age 50, your risk for breast cancer is also slightly increased. That's because your breast tissue is exposed to estrogen for longer periods of time. And finally, there is a clear link between alcohol and breast cancer. Those who have 2 to 5 alcoholic drinks daily have 1.5 times the risk for developing breast cancer as women who do not drink. If you think you might have breast cancer, what should you do? The most important screening test to detect breast cancer early is the mammogram. A mammogram is an X-ray of the breast. It can detect breast cancer long before a tumor might be felt. It is recommended that women aged 40 and older receive annual mammograms. Studies show that women who participate in mammography screening reduce their risk of dying from breast cancer by 41% and experience a 25% reduction in the rate of metastatic breast cancers. Fucoidan is derived from brown algae. It is a sulfated polysaccharide molecule. It has shown a wide range of biological activities in research, including the anti-cancer activity of Fucoidan has been extensively studied. Existing research has demonstrated that Fucoidan can directly exert anti-cancer actions through cell cycle arrest, induction of apoptosis, and can also indirectly kill cancer cells by activating natural killer cells such as macrophages. Let's see how Fucoidan can eliminate tumor cells and delay tumor growth, in vitro, in vivo, and in clinical trials. Previous studies have found that the anti-cancer mechanism of Fucoidan mainly includes the following 4 aspects. First, Fucoidan can suppress cancer cells' growth by inhibiting the normal mitosis of cancer cells and regulating the cell cycle. Second, Fucoidan can activate apoptosis of cancer cells, which is cancer cell death, and thus produce an anti-cancer effect. Third, Fucoidan can suppress angiogenesis, which is the growth of blood vessels that feed the tumor cells, thereby cutting off the nutrient and oxygen supply to tumors, reducing the volume of tumors, and blocking the growth of cancer cells. Fourth, Fucoidan can also activate the immune system, enhancing the ability of our immune cells to destroy tumor cells. innovative gel supplement contains Fucoidan extract from the world's finest deep-sea seaweed from Japan. Mr. Joel Rockwood, Vice President of Research and Development at GelPlus and an expert in gel suspension technology, has developed Umi, a modern gel supplement that is convenient, easy to take, tastes good, and absorbs within 3 to 15 minutes. This is the world's most advanced technology, the first and only one proven by research from the Clinical Research Center and Faculty of Medicine of the University of Minnesota and Mayo Clinic, USA. The research shows that the suspension gel is 5 times more effective than the tablet form. Umi, first Fucoidan gel supplement in the world. Umi has been available for over 20 years in more than 20 countries worldwide. For more information, contact GelPlus sales representatives